I wanted to look into male breast cancer because I had done a similar study looking at female metastatic breast cancer. And after studying for our annual test and reading up on male breast cancer, I had this idea of why don't I look at the same thing in males to see what the survival advantage would be for surgery in stage 4 disease.
It's a very understudied area. I wasn't sure we'd have enough data, and I was surprised that we actually had more data than I expected. And so that's one of the nice things about using the NCDB database.
I think we were both surprised that we were able to get over 500 patients in our population. Looking at the other studies, a lot of them had far fewer patients and they were studied for about the same amount of time period. Our study was from like 2004 to 2017. So it was generally a large amount of time, but because of the low incidence, we definitely needed that to get our sample size.
Well, men have generally less breast tissue, and so the cancers are more palpable. But I think while the incidence in women is 1 in 8, the incidence in men is 1 in 1,000. But when you look at the data, metastatic breast cancer, stage 4, in women, it's about 6% of the patients present in stage 4. In men, it's close to 10%, so it's almost double. And if you look at high stage, late stage, stage 3 and 4, in men, it's 40% of disease. So we're seeing worse prognosis based on staging in men because of late diagnosis. So awareness is important.
Right now, the NCCN guidelines recommend that all men should be treated with systemic therapy at stage 4 disease. And surgery is for palliation of symptoms such as ulcerations or pain or bleeding. So this is kind of arguing against that this surgery should be offered for more than just palliation of symptoms and more for a treatment.
And I think one of the things to bear in mind that's very important is in treatment of all breast cancers, male and female, we've made huge progress in our systemic treatments. And so because our systemic treatments are working better, now those adjuvant additional treatments may add more benefit than they did when we really had very poor systemic treatment. Breast cancer in men deserves attention, and that the treatment paradigms are changing, and that we want them to be contemporary with the ones that we offer our women patients.